introducing Dr. Miriam Safahi. And if you could just kind of let everybody know a little bit about your background and what brings you here today. I would love that.
Yes, absolutely. Thank you so much, Tafina. I'm so excited to join you all this afternoon. I'm actually on the West Coast, so this morning. So I'm a board-certified dermatologist. I've been in practice for almost a decade now, and I have a personal interest in hair loss. A lot of folks don't realize that dermatologists actually do treat hair loss. Most dermatologists don't love treating hair loss because it can be very challenging, but I have really gravitated towards it, and I really like to speak to patients. It takes a lot of time and effort to really get to know the patient and what it is that is like triggering all of these issues that often cause with hair loss. So I look forward to getting into some of those things today, and this very exciting conversation we'll have.
Thank you so much. And then as well, I would like to introduce, for a lot of you, she's a familiar face, but for those of you who she's not, I'd love to introduce Angela and Angela Gooff, and have you let us know, just outside of being an amazing hairstylist, like what compelled you to be a part of this conversation today with your experience.
Thank you, Katina. Thank you, Dafina, for having me. I'm so honored, honestly, to be here. I've obviously had done extensions for 27 years, and the reason why I got into the extension end of hairstyling is because I have kind of crummy hair myself. I struggle with it. As soon as I mean, you guys can tell I've got a pretty strong part line as well. And as I've aged, I'm in perimenopause now. I've noticed a huge struggle with hair loss as well, just for me. I see it on a daily basis. This is what I do all day, every day is extensions. And I deal with women and help them overcome those struggles that they have with hair loss every day. It's an ongoing conversation. And so I'm honored to be here and help answer questions that I can honestly just learn from our doctor as well.
Okay, well, with that, we'll get started. So we have a list of questions that some people have submitted. We've been talking this up for the last 2 weeks. But also I think, feel free if there's something that you would love to go and give a little bit deeper context. Like, let's not be locked in by the questions. Let's let it inject a little bit of our personal experience too, because I think as a founder who also is like experiencing perimenopause, and I listen to the story all the time of like, extensions are great, yes, but you still also want to feel great about the hair that you have in your head. You don't want it to be, I always say you want it to be an accessory, not a necessity. And we really, as part of like, really for me, as a founder of Covet in Maine, was always looking for solutions that still had the conversations around what brings you to get extensions and support you in reaching your goals without, having it be mutually exclusive that you have extensions or you have healthy hair. Like, how do we balance and get both? So I'm excited that we have 3 wonderful women to kind of have this conversation today. So the first and the biggest, I think, thing people want to know is like, what are the most common causes of hair loss and thinning in women, especially as we age?
So that question for me, I presume. Yes. So this is a question that we get all the time. And actually, this is surprisingly where I really rely on stylists. And this is interesting because stylists are the first person to actually identify this because they see your hair like either monthly or every few months, and they start over the progression of several years that they've known you. And they're the first to say something. And often that's what triggers a patient to come see me. And they're like, oh my gosh, my stylist noticed this. Like, can you tell me what's going on? One of the main things that occurs, like, and we'll speak mostly about females here, is female pattern hair loss. And female pattern hair loss, the other name for it is androgenetic hair loss. And that is basically someone who is genetically predisposed to have thinning of the hair. The males get this as well. And males, it's called male pattern hair loss, and that's where they get kind of like the widow's peak here, or they'll get balding at the crown as well. In females, however, and we can get more into this in a little bit, but the most common is that you'll start noticing widening of the part line. And that is something that the earlier you recognize that, and the sooner you get into a dermatologist, the faster that we can get you on the right treatment plan so that we can preserve the hair you have and get you back on like the regrowth journey. So that's the main one. The second one is telogen effluvium, and that's something where you may have noticed this where you, after like a major event in your life, for example, after childbirth, after a major surgery, after a really stressful event, something you'll suddenly start noticing several months later that you have massive shedding of your hair. And patients will come in and they'll say, oh my goodness, like I just feel like all my hair, it's like on all the time. And they're like, I know I need to like, 100 hairs a day is like normal, but this is like tons that's coming out my shower. And I hear that a lot. And it's not just like one focal area, it's like everywhere. And
Okay.
that is actually super common. And that's often triggered by a major event that's occurred either to your body or like a life stressor. That
Okay.
usually gets better over time. But during that time period, you're just going in like crisis mode.
Now, a question following up on that, because Angela, I've heard you talk about this a lot too, is like it's either even with like the increase of like a GLP-1 or sudden weight loss, are you seeing that contributing to hair loss as well more recently? Like just anecdotally, I'm not holding you to like a clinical study on this, but have you found that at all?
Yeah,
Yeah.
for sure. Sorry, doctor.
No, please.
Sorry.
Please. Yeah.
We have for sure seen it, especially with COVID. COVID was a huge like struggle when people were just noticing in handfuls hair was coming out, and also with everyone being on the skinny shot these days, it has been huge. And I mean, I would say probably everybody that's on that shot has experienced some form of hair loss as well.
And Dr. Safi, have you found that as well anecdotally, or do you think it's just more that I'm just curious from your experience clinically?
Yes, absolutely. Definitely anecdotally. And actually, they've started to find that there's definitely evidence base to prove this
Okay.
as well. I'm in Los Angeles and almost everyone is on it. And so this is something that we're seeing a ton of. And so I almost ask every single person if they're on a GLP-1, even if you're microdosing GLP-1s,
Okay.
that can still lead to this. And it's mostly because of nutritional deficiencies.
Okay. Okay. So that's interesting. So, and this kind of brings it up into what we were saying is like how you differentiate between normal shedding and something more concerning, which you've already brought up, but just in terms of like deficiencies or vitamins, nutritional, stress, cortisol, perimenopause, like as a dermatologist, how do you balance? Is that something that you're looking to screen for? Or are you just more treating it more for like, okay, the hair loss is here? Or do you like, how do you balance the diagnostic part of that?
Yeah, so that's why it's really important. Like you spend time with the patient. So a lot of us who do specialize in hair loss, we do have like a questionnaire that we have the patient, or we spend time just asking the questions during our clinical visit, because it's very nuanced in with hair loss. And so when it comes to, I mean, we did describe the widening of the hair part line, but other things that are major factors as well is like and I'll ask a patient this because they won't offer this information to me. I will ask them, do you like when you put your hair in a ponytail, have you noticed that your ponytail is getting thinner and thinner? And they're like, oh my God, yeah, I have. And then that's like, there you go. Their hair is like, they're diffusely shedding. And
Mhm.
so those are the kind of questions that you want to ask. And then you can also ask as a stylist as well. Because one thing that's really important is that someone may have thick hair. And I'll have some patients who come in and who already have thick hair, and someone's like, what are you talking about? This person doesn't have hair loss. But for them, their baseline is different. For
Yeah,
they're like, okay, sure, I have thick hair, but it was way more thick than this like a year ago. And that's what's really important, that you acknowledge that, because if you just kind of like poo-poo that, then they already kind of feel defeated. And this is a very emotional journey that they're on. And so it's important to like see what is that person's baseline and then go from there.
that brings up a good point because I think, Angela, and I have a question for you too on this. I know as an extension wearer, sometimes we don't even know what our baseline is because we've been wearing extensions back
For
to
so long.
years. And so you might only have like 3 hours when you're at the bowl getting your color refresh and your extensions are out. Do you have any tips for stylists who, specialize in extension? Because you already feel like a bald cat when you take out, your hair.
We
So you're
do.
already vulnerable. Like, how have you balanced that, Angela?
The first thing I do, Dafina, is I take really good photos beforehand, before ever starting the process of the extensions. I make sure I get really good photos, get them to really explain to me the struggles that they're having in the beginning. And whenever I take the form for them, like if we've got a form that we have them fill out before they come in or even in the chair, they explain the struggles that they're having so that 6 months down the road, when we take, 150 grams of hair out of their head, they're like, oh my gosh, I'm so bald. And I'm like, listen, this is what you explained to me in the very beginning. This is what your photos look like before. Now we've colored it, dried it. We're about to put these back in. You actually, what I've noticed more than anything is the extensions tend to almost help, especially the ends of their hair. It almost kind of protects their hair. The struggles is when they really start to notice the struggles with at their scalp and they're actually thinning. But it is every time we take that hair extension piece out, it is a struggle, and they're afraid to, to wear their hair without their extensions. And it has to be something we have to kind of step into lightly, because it's, as a woman, it's who we are, it's our crown. And so, we've also just been putting this in the salon lately as, we're trying to give some privacy for the guests, because it's been something that a lot of women are struggling with lately. And it's a everyday occurrence in the salon.
Yeah, and to that point, Dr. Safi,
Oh,
Dr.
that's fine.
I love that. Dr. Safahi.
Yeah, lots of eyes there.
What would you give tips for stylists? Like, what is the most respectful, effective way for a stylist to kind of step in and be that intermediary? Because I do think, as your point, a lot of us, I myself personally, and my hairstylist is actually on here, and she was kind of the one who mentioned to me, like, maybe you want to think about minoxidil, or Rogaine, or like, and it can be a jarring moment when you're in the chair. But do you have any tips for stylists to just start taking that first baby step of language that they can use, or how they might even begin to broach the subject of a referral to a dermatologist or interventions?
Yeah, so it's all about how you say it and not what exactly you're saying. And so and this might sound cheesy, but I honestly feel like if you come from a place of like love and you're caring, I mean, I do this to my own friends. Like just the other day, like a girlfriend of mine who like I care about, and I noticed like she's 45 years old, just had a baby. And so like all of these like hormonal factors are playing. She's like perimenopause kind of at this point now too. And then she had thinning of her crown. And I mentioned, I'm like, have you noticed that this has been going on? And, some may be like, oh my gosh, that's so rude. But it's like, no, if you care about someone, don't you want them to be like, look great for the rest of their life? And especially if you know that you can help them. And so that's how I see it. And I do feel like most folks, when they're in your chair, they are like putting everything in your hands to like, they're there because they want to feel great about themselves. And so like, they are looking for any advice that you have. And to withhold that information is somewhat cruel. And so why not tell them like, hey, I've noticed that you might like your hair is a bit thinner than it has been over the course of the last 6-7 months. Has something been going on? And perhaps there is something going on personally that would shed light, and that could kind of be along the lines of that telogen effluvium. Or if they're like, oh my gosh, I didn't even notice. Thanks for letting me know. Because it's often like the top of their scalp and most people don't even notice, or at the back of their scalp. So I think they really would like appreciate like having like a trusted relationship with their stylist.
And a question that, like, what do you find is what type of appointment do you make with a dermatologist for this? Is it something where you're like, I just want to consult? Like because I feel like even for a lot of women, you don't even know where to take that first step. Like,
Yes. Okay, so that's really important because like I mentioned earlier, so a lot of dermatologists don't love doing hair loss. And it's one of those things that the minute they see it on their schedule, they're like, oh gosh. And so what I would do is when you call to make the appointment, ask the receptionist, does this individual specialize in hair loss? And if they don't, then see if there's any referrals for someone that does. Because if they don't, then they're not going to want to spend the time with you. And it's just going to be a waste of your time and your money. And it's going to be even more frustrating. So that's what I would say is like the best thing. Because you want to go to a dermatologist that actually does this for a living.
okay.
And will spend the time. And then it has like all the resources to help you as well.
Okay. That's a great point, because I've found that where you're like, I don't know, like, is it my primary care? Is it my OBGYN? You're trying to get blood work done. You don't know where to begin. And so you're kind of left running back to your stylist. And
Yeah.
so to another question for Angela is like, how have you helped your clients? What are some of the effective tools that you've helped like hold your client's hand for this process?
Obviously it's a good conversation of how often are you shampooing? Have you just questions, it's simple questions. I really find that what helps me with my client is get knee to knee with them. I'll grab a little chair, pull it up. They love the privacy of just us one-on-one talking about what have you gone through with has life changes? Have you had a sudden weight loss? Anything crazy happening in life? And if that is something that we're noticing, I start with the products that we have on the shelves, like we use Orbe in the salon, try to refer them out to something like that. Obviously it's not just external, it's internal as well. What is your diet like? How often are you taking your vitamins? All those things play a part in our hair loss, and how well are you managing your stress. And then if it's something that I really feel like they're going to struggle with even outside of me helping them, then I would just politely say, why don't we do this? Let me have you reach out to your dermatologist. That's the first person that I would reach for. And a lot of clients don't even realize that that's who they're supposed to go to for hair loss. They sometimes will think, oh, I was supposed to go to my doctor, but to me I always have referred out to a dermatologist.
Okay. Um, but I love, Dr. Safahi, how you're mentioning like really being able to help find a dermatologist who specializes in hair loss. Do you know of any like directories or resources or places that we might be able to find or recommend or refer to hair loss specialists within the dermatology field?
That's a really good question. And I mean, our national academies, the American Academy of Dermatology, and oftentimes there's like a resource there, but that can sometimes be daunting for individuals. There's smaller hair communities that we have as well. And what I can do is actually send them over to you later, and perhaps we can post them
Okay.
as far as like our links. Because there are certain individuals also that specialize in textured hair or like with
Yeah.
uh, female patients of color. And there's a whole nuance within that community as well.
Mhm.
So I think some people may feel more comfortable going to someone that they feel like would understand my hair type and would, prefer that.
That brings up a good question, a good point about the textured, and this is, stereotypical, but as someone who we tend to get more micro braids or, grew up getting cornrows, just more cultural styles that lead to traction alopecia. Is traction alopecia something with under the purview of a dermatologist, or does that more start getting into like needing like hair transplant solutions? Like how does that fit in with under the umbrella of hair loss?
Yes. So this is, I cannot like stress this enough, like how important it is that you do find someone who knows what they're doing. Because I have seen this innumerable times and it like just irks me every time I see it. It's that someone who, like let's say an African American woman in her 50s who comes to see me and they've been experiencing hair loss for over a decade. And they're like, oh yeah, I've just been told I have traction alopecia. And it's just because the clinician didn't know what they were doing. And that was
Mhm.
kind of always the default diagnosis to give someone. And it's somewhat of an area of like, and certainly traction alopecia is a real thing, and you can prove that with biopsies. But just look at someone and say, oh, you have traction because of the way you do your hair. Like, no, there's been most of the patients that I've seen after performing biopsies, I'm like, oh no, you had this completely different type of hair loss. It's a scarring hair loss, which means the longer it had just sat there and not treated, then you were just losing hair and the follicles are scarred down now. And there's nothing one can do. And it's really heartbreaking and it makes me just really sad that like just within the community, one needs to educate themselves upon this. So I do tell patients, like, if they don't feel like they're hearing the right thing, then go to see someone else and get two
Okay.
different opinions. And if then you're like, okay, they're both saying the same thing, then the likelihood is probably right.
Okay.
One thing you can always ask for is a biopsy as well,
Okay.
hair
Interesting.
biopsy.
Okay.
Um, and so some dermatologists will say, "Oh, I don't need a biopsy," and that's certainly true. Like there's plenty of like the clinical morphology, as we like to call it, that we can see and say, "Okay, this is where this fits into this particular hair loss." But there are times where it's not just one type of hair loss; it's two different types of hair loss, and the only way you
On the
can
same head.
Yes, like
Interesting.
more often than not, actually. And the only way to really know that is with a biopsy, and
Okay.
then to have someone, again, who specializes in hair loss, who has a lab that can read those biopsies, because reading hair biopsies can be very challenging. You see, it all goes hand in hand. And
Okay.
that's why most of these us who do specialize in this already have folks that we know that we can trust who are reading the biopsies that will give us the correct answer, because then we rely on that to lead us down the treatment plan.
Okay, love that. Now I'm going to ask both of you. So I'm going to preview your questions just so I want to kind of know, Angela, salon services that you're really excited about for helping not just prevent, but also ameliorate any hair loss. But then Dr. Safahi, I'm really curious for you, what are some of your most effective treatments right now that you offer? And then 2, what are you excited that's kind of like in the pipeline for hair loss? So I'm going to start with you, even though I put you on this, Dr. Safahi, and then Angela, I'll come to you after.
Yeah, so I like to view it as there's over-the-counter products someone can use and prescription strength. We are somewhat limited in the over-the-counter products. And if you go search, it's a $1.5 billion industry, the hair loss industry, because people are willing to do anything to like maintain their hair. I mean, you covet your mane. So it's very true. So with regards to things that you can buy over the counter, like let's say you're like, I don't have time to go see a dermatologist just yet. Like it's not that bad. I want to do something that I can just like buy off Amazon. So topical minoxidil, we've all heard about this. It's Rogaine. You want to make sure that you get the 5%. They sell it in 2.5% and target to women for it. It's useless. It's garbage. Just don't even bother with it.
Okay.
So 5%, either the foam or the solution. Most of the studies, when they did this, they did it twice a day. Most people, though, only do it once a day. So if you really wanted to like do it effectively, you're supposed to do it twice a day and give it at least 6 months. So that's something that you can do. They sell it at Costco. Easy. You're there are a lot of folks like using oil. So rosemary oil has really gained traction over the course of the last several years. Pumpkin seed oil has also started to pick up steam, and those can help as well. The equivalent of rosemary oil is equivalent to 2.5% of topical minoxidil.
Wow, I did not know that.
So that's so someone who's like, I don't want to use something like prescription or like medical grade, the oils is like, that's where those come from.
So for oils though, is there a way that you would, for efficacy, that you would recommend like a dosage or a usage that you think is best for those?
Yeah, so usually with a scent, again, if you go on Amazon, you'll see like a myriad of folks who are like selling various concoctions of oils, and most of them have already been diluted. If it says for hair loss, they've been diluted to effectively apply to the scalp. But if you wanted to like make your own, if you get the essential oil, you would then dilute it into castor oil.
Okay.
And basically you want what's called a carrier oil, and castor oil is one of the main types of carrier oil. Coconut oil is another one as well.
Okay.
Putting an essential oil directly onto your body is not great. It's just like really intense. And so usually say like take a tablespoon of castor oil, 5 drops of rosemary oil, and like you would put that on the scalp. Same goes for like pumpkin seed oil as well.
And is this daily would you recommend, or before you wash your hair? Like what frequency would you recommend?
I would definitely do it like after washing your hair, because if you do it before, you're essentially just washing out all of the components. So if you can put it on overnight and then wash it off in the morning, that would be ideal. But yeah, remember there's only so much that can be gleaned from that. So then after that, I mean, most of this, there are some like peptides that are also coming out to the market as well, and those are ones that can be sold like without a prescription. And that's like the next big thing within like the serum peptides. We use it for the face, so why not use it for the scalp? And so we're starting to see it there as well. Now, when you go to prescription strength, like when you come see me, then it's like a whole level that you can unlock. And if you start noticing that, okay, I've done 6 months of these over-the-counter things, I haven't really noticed anything, like it's time for me to go see someone, I have much more in my arsenal. So then we have like oral minoxidil, we have oral tablets with regards to like hormone, I wouldn't say blockers, but hormone stabilizers, shall we say. And I won't get too much into the science at this point. But something exciting that's coming on, I know most people have already heard about PRP, but now there's exosome therapy as well. Exosomes are very exciting. And exosomes are incredibly expensive. So just the other day, there was a client, and I mean, it was about, gosh, $3,000 to $4,000 just for like one session.
Wow. And
Yeah.
this is being insert. So can you explain exosomes are stem
Mhm.
cells? Or is that as
Yeah.
derivatives of stem cells? Is that correct?
Exactly.
Okay.
Exactly. So the derivative stem cells, and the problem with exosomes, if you go read about them online, I mean, part of the issue is that there's not a ton of evidence to support this. And so some dermatologists will be like, well, we don't know yet. But I definitely have seen a lot of plastic surgeons using it. Again, also for hair loss. And those that use it, like, really swear by it. The key, though, is that you want medical grade exosomes. So
Okay.
someone who's like selling an exosome like out of the back trunk of their car, like not exactly like you're not getting medical grade. There's plant exosomes as well.
Yeah.
They're not as effective as
Okay.
human exosomes. And I think the problem is there's a lot of like FDA regulation around this. And so that's why it's been a bit slower to adapt here in the United States. You'll see a lot of this being used overseas.
Like I've seen
Just
in
because,
Korea, this is like a big
yes,
people
huge.
traveling for there. Okay. And
Yeah.
but you're excited about it. You think there's a lot of promise
Yeah.
with it.
I
Okay.
think it really does. I mean, it definitely does stimulate the stem cells. And if you have like all they need to do is like waken those cells up to like start like generating the hair follicles back. So
Exciting.
to be continued, but I'm very excited.
And do you have any thoughts on like the laser caps or the red light therapy around for, I don't know if it's maybe just more hair optimization. I don't know if that helps with
Mhm.
hair loss. What are your thoughts on those treatments?
Yeah, so that is actually, thank you for bringing that up. Actually, that is also another component. And there's like you go and look online, and there's like they range in price from like $100 to like $3,000, and you're like, what in the world? Um, so there is definitely the wavelength that you want with a red light, and that's actually kind of where the difference in price comes. There's only one company, and I'm not sponsored by this company. I don't get any money from this company. That is we have consistently used. It's called Capillus, and
Okay.
they make these caps that are like red light, and they have a wand as well. But I find that the cap is the most effective. They range in price from about like $2,000 to $3,000. I usually recommend them for folks who just have money to just throw around, and which surprisingly a lot of people when it comes to hair loss do. So, it's not like I would say like go get the cap. I would say like if you want to just it's a Hail Mary at this point, the cap is one more thing that you can do.
Okay.
There's no harm in it. It's just
Okay.
financially challenging.
I love that. Thank you. That's
Or
it's fun. It's very exciting to see what works now and what could work soon. And Angela, what have you found? What's your experience of effective treatment?
For me, it always seems that thankfully, the hair loss situation, if there isn't anything permanent, it's just a sort of like a life change or something that they struggle with some hair loss for a little while and they come back and they seem to, start having, the hair growth again. For me, it just seems that thank God for extensions. Oh my gosh. Being blessed with, these fine wefts that we have, the K-tip, the methods that we're struggling, that people around the front of their face were struggling with for so long. We're so blessed to have a company like you guys that we've got the smaller, K-tips, the education and the concealed methods that we're able to, add this hair until whatever they get through, to help them through this moment of finer, thinner hair. Having babies has been something that I see a lot of my girls struggle with fine, thin hair. Obviously, COVID and all the weight loss. That whenever they do wind up going to the dermatologist, it feels like we're noticing it's not something that's more permanent. It's kind of for a short bit. And we really just can kind of get them through that with the craft of the hair extensions. Thank God for that. Oh my
It's
gosh.
having the conversations for those who are pushing the lines of where hair extensions, like you're either adding too much in or you're
Mhm.
having unrealistic expectations. Like, how do you have those conversations? Or when sometimes they need to take a break, like, do you feel comfortable as a stylist stepping in to like intervene for hair health? or how have
We
you?
do. I do. We have this conversation a lot in our classes that we have when we're educating about the different types of hair extensions that we educate on with Kevin and Maine, that you just really have to become really close to that client. I always say it's a relationship. If you can't talk to me about what your struggles are, we really can't help you. And so I'm pretty honest with them. Sometimes they want a ton of hair put in their head, and it's just not the reality. I don't think that their natural density can actually handle what they're wanting. So, being okay with saying no is something that you have to learn when being a stylist. You've got to, obviously, there's wants that they have, but the reality is we don't want to do something like a traction alopecia situation. Thankfully, I've not ever seen anything like that from extensions that we've done. But I think that's where education really comes into play. I think you've got to really be overly educated. You're adding something to someone's head that they have to live with for 6 to 8 weeks, and you have to educate them properly on how to maintain that at home and what the reality of hair extensions is like. I mean, it's not this supermodel type thing that you come back and it's going to look the same. They have to maintain that at home, or they will have issues where they might have to go see a dermatologist. So just being real with your client, it is like I was saying, it's a relationship. It's not just putting those extensions in their head and shoving them out the door and hoping you don't hear from them for 6 or 8 weeks. It's the education that we're ongoing, all the time with Covet and Maine on the website, on our social media. We're constantly trying to push out as much information as we can to make sure that the life of this extension wear is something they can continue to wear. If they don't maintain it properly, it's something that you're going to really start having issues with, and we'll have to send them to a dermatologist to fix all these issues. But the doctor's really given us some great advice on things that we've heard in the past that we wondered, like the red light therapy. I've got clients who are struggling with like their hormones fluctuating. I have a whole client who she lost the whole back end of her hair at one point, and she wore a red light cap, that same exact brand that she was talking about, and it helped. And so for me, I was able to see, wow, this is something that we can, to give the information to others as well. So just passing along information of things that she was telling us about, and things that we've seen in the salon as well. Um, proper proper diet is huge. When I don't eat properly and don't hydrate myself properly, I see a huge um, problem with my hair. So I think it's you know a whole gamut of knowing what we have to do topically and internally to have success.
Yeah, I think it's very intentional that, I say there's a reason why when I'm stressed, it shows up in my hair, because that's the place I'll pay attention to, right? Like if it showed up in
Yeah.
my toes or whatever, I'd be like, I could ignore it. But like my hair, I'm like, no, I need to pay attention. Um, Dr. Safai, I'd love to just, as we kind of get towards wrapping, and we'll answer some of these questions that came in as well. Um, just from your perspective as a dermatologist, what do you wish stylists would listen to or heed your advice a little bit more, especially when it comes to the world of like coloring and extensions, that would be more optimal for people to avoid having to see you, basically. Let's put it that way.
Oh, that's a good question. I feel like if anything, if stylists are often like so in tune with a hair that it's not so much like from the stylist I have issues. It's like sometimes patients themselves will come up with these theories. And then maybe the stylist doesn't like debunk them. And one of the major ones, and this may come in hand like with the extensions, is not washing their scalp enough.
Yeah.
Um, I hear it's every single day. Like I'm just like, how often do you wash your hair? And they're like, oh, twice a week. Twice a week? Like, why? And I'm like, do you not have access to it? Like, honestly, I'm like, do you not have access to a shower? Like, what is the reason? And they're like, no, I just don't want it to lose. That hair is gonna come out anyway. Like whether you wash it or you don't wash it, it's gonna come out. Like, and the minute you tell them that, they're like, oh, okay. I'm like, don't torture yourself and like leave your hair dirty and it's kind of smelly. And the issue with that too is that then you also get this sebum. So that's oily that we all have on our body that starts building up, and then yeast starts growing and eating that sebum, and then they get dandruff, and then that dandruff is actually what like can also perpetuate the hair loss. And so it's this like vicious cycle. And so if people think that like by not washing their scalp, they're actually preserving their hair, and it's like totally wrong. And so certainly there are certain types of hair that does not work well with washing every day. So
What
like,
would you say is like if you had to put bands of ideal for maybe like textured hair or for fine oily hair, like what is the general ideal range of washing your hair, like frequency wise, would you say?
yeah. Okay. One thing I will say is that it's really important though to give like agency to the individual as well. So like someone who has textured hair and they grew up with textured hair their own life, they are going to be the expert in their own hair. However, so for example, if they're like, hey, I do best when I wash my hair every 2 weeks, then that is what works for them. And that is something that like you respect. Like it's really jarring if a dermatologist tells you like, no, wash your hair every day. And you're like, no, ma'am, like I have textured hair. Like that's not how it works.
Yeah.
And so that's more about like just being like culturally understanding. Now I will say, so textured hair, depending on the individual, like every 2 weeks or so. Um, Curly hair, also less likely to wash their hair again because of the tight curls, depending on how tight those curls can be. Again, most folks will only wash their hair like 2 or 3 times a week. And so those individuals I don't badger because it makes sense. Folks with fine, really fine, thin hair, then also they can get away with just like what, because they don't even get oil on their scalp. And so again, they can wash 2 or 3 days. But I would say the vast majority, I would say every other day
Okay.
if they can. And again, that's where it's important that you use the types of like shampoo and conditioner as well.
Okay. I love that.
That's
Thank
what we've noticed. I'll
you.
tell you guys, that's what something that I've noticed as a stylist when it comes to extensions. I think they're avoiding it because it's just so much more hair in their head and they think it's a pain to wash and dry. But I'll tell you, I think we've seen a lot of hair loss because, we'll bring these clients in and we'll take these extensions out. And like she was saying, there's like oil built up around the extensions, around, the beads that we've taken out, and it
Yeah.
smells. Oh my gosh, it's so bad. It is an issue that because we all said, oh my gosh, I have hair extensions. I don't have to wash my hair but once a week. And for me, I have fine thin hair. I have to wash my hair every other day. And what I've noticed is I'll say, listen, and that's what they ask. How often should I be washing? When you start to see a little bit of a buildup of oil and your hair starts to feel funky, wash it. You know what I mean? Like you were saying, textured hair, you don't have to wash textured hair as often. But when they start to feel that their hair is kind of getting grimy, it's time to wash your hair. When you sweat a lot, you've got to get your hair washed. I think that's what, for me as a stylist, I've noticed most of the hair loss is because when I go to wash their hair, they haven't washed it in over a week, and it's just like all this hair shedding. And I mean, isn't that clogging your follicles too? It's just it can't be good. So
Absolutely.
Well, this was amazing. I'm going to ask, there was something that kind of came up in here, and I think it highlights a question that I didn't ask. So one is in terms of recommendations around supplements. I know a lot, there's so many new supplements that have hit the market. There's, the historical ones of like biotin and prenatals, but I just want to get your thoughts and your perspective on how to approach supplementation and recommendations. And then also that kind of layers into a question that I see a lot with is if somebody stops taking these supplements, do they lose progress? And I also see that as well with like the Rogaine as well. Have, your opinion on it. Is it just to get you where you want to go, or is it something that you're going to need really the rest of your life?
Yeah, so this is the number one question I get asked because they're like, Doc, is this a forever thing? And I'm like, for the most part. So unless kind of like what Angela had alluded to earlier with the telogen effluvium, which is where, individuals who they have like the massive shedding, but it's only temporary. And usually that just then stabilizes and over the course of like 6 to 9 months. And then people are like, oh, okay, then I can come off all these things. But for the rest of the types of hair loss, which is like, the majority of other types of hair loss, those are forever.
Okay.
And so usually when you want to pick a routine, it's something that you want to think like, okay, what is this going to like work into my life? Am I someone who's going to remember to take pills every day? Because a lot of these supplements, they're huge. They're like horse pills. And they're like you have to take them 4 times a day.
Yeah.
And like I don't even remember to take my prenatal. I mean, I do remember taking my prenatals, but like, it's one of those things it's got to work with someone's life.
Yeah.
There's a million supplements out there. I know there's a brand that they're putting out recently with Covet and
Okay.
Main as well. And so I reviewed it and it was
Right.
excellent. So perhaps we can get into that. And all the ingredients that are in the particular supplement you're rolling out here soon is fantastic. So I would definitely start there. But yes, there's a lot out there, and I would say that certainly you can choose based on your budget because they do
Yeah.
get very pricey. And think about it, this is something you're doing forever. Um, so I'd heed a little to that. With regards to like vitamins and such, biotin always comes up. Biotin is like a B vitamin, and so certainly if most people get it through their diet, but having excess, you can helpful as well. Like a protein builder, shall we say? And so like
Yeah.
hair, skin, and nails, essentially how they refer to it. I will just make one quick comment though, with regards to in the vitamin category, is the vitamin D is something that you definitely want to get checked.
Okay.
So if you go see a dermatologist that is specializing in hairs, almost always they'll check your vitamin D. And actually, most primary care doctors will do this as well. So let's say you can't get into your dermatologist, ask your primary care for a vitamin D.
Oh,
Um,
interesting.
because your vitamin D is actually really relevant to like most functions of your body, and you would be shocked how many people have low vitamin D. I lived in Los Angeles and my vitamin D was extremely low, and I was just like, what in the world? Because I worked indoors all day.
Yeah. And
Most
I
of it.
and it's also something for people of like with darker skin tones, the more melanin you have in, it's harder to, is it a less of it a harder to absorb, or it's like more likely to be low in it? I don't know the clinical behind it, but
It because you do get like the vitamin D from the sunlight as well, and all it really does take about 10 minutes. Individuals with pigmented skin have a little bit of built-in SPF, so they require a little bit longer time in the sun. So if you're someone who avoids the sun just based on your lifestyle, again, that's why it would be easy to become vitamin D deficient.
okay.
And that's something that is easily checked, easily fixed, and like not only will it contribute to the hair regrowth as well. I mean, that alone won't help everything, but
Yeah.
certainly a key factor that you want to make sure is like optimized. The other component as well is your iron stores known as ferritin. So if you are a woman who is menstruating pretty regularly, you are losing blood. And more than you're able to actually like make, let's say. And let's say you're just on some sort of restrictive diet or just don't eat tons of red meat,
Yeah.
that is important to check as well. And what I like to do is like you like to even keep it higher than what's the upper limit of normal. So your levels may come back normal for ferritin, but if you want to optimize hair growth, we even go like higher than that.
Oh, interesting.
And that's through supplementation, like through iron supplements that are just found over the counter.
Well, I have a question. I've been lately into, I don't know if this is dermatologically approved, but I've been like cooking in a cast iron pot as well to help. Do you find, like I heard anecdotally that helps as well? What are your thoughts on that?
Oh, that's interesting. Beyond the fact that probably the food tastes better overall. So, I mean, I feel like cast iron cooking is excellent just because you don't have all these external like uh like factors now that especially we have no idea where most of our products are made overseas. It's a bit of a pain like cleaning them. But certainly cast iron is ideal if
Okay.
you can do it.
Okay. Oh, that's interesting. Yeah. And this has been amazing. And I like hope that we can maybe do this again in the future,
Mhm.
because I also know there's a whole other conversation related to, for some of us, the hormonal part of it,
Mm.
and like using HRT and testosterone and pellets, like the whole gamut. And I just think that, it's so lovely to be able to collaborate and have this conversation from many different directions, because it's like, it's beauty, it's emotional, it's scientific, it's diet, it's stress. And you too are really at those two pillars of it. And just being able to get more conversations between the stylist and the dermatologist, I think will help so many more clients. Okay, so that was me saying thank you, thank you, thank you. I'm gonna wrap with, you feed me the questions because I can't find them. What's the other one? We have two more questions.
Is it true matcha causes hair loss? Is it due to caffeine or is this false?
Did you hear that question? So it was about does
Mhm.
matcha contribute to hair loss?
Yeah, so I've seen that question actually, and it was the first time I ever heard that. It's interesting because actually we use caffeine in a lot of supplements to help with hair growth, and so it's somewhat like counter productive to what we usually preach. Matcha in itself is a pretty organic supplement, and it's pretty healthy overall. It has less caffeine intake per volume than regular coffee, shall we say. But I would say that I have not heard that consistently, and there does not appear to be any evidence to support it. If anything, caffeine is actually helpful for hair growth. So I would keep drinking the matcha.
Okay, love that. What's the next question?
What are some underlying health conditions that could contribute to hair loss?
Sorry, what was the question?
The question was, what are some underlying health
Ooh.
concerns or issues that can contribute to hair loss?
Yeah, so this is
What will we
huge.
talk about?
And this we can definitely, and I would love to come back again to do one whole episode on with hormone, because hormones, I believe, are like huge and like highly underrated, how much they contribute to like literally everything in our lives, especially as females. But I would say a major one that we see is thyroid deficiency. So thyroid disorders are autoimmune conditions. In North America, we have like overabundance of autoimmune conditions. And you'll see many who may not be like fully fit into the box of autoimmune, but they kind of have this quasi like subclinical thyroid disease, shall we say, where like they feel sluggish and they feel like they're just like tired all the time, and like they have the weight gain, like all of these symptoms, and then hair loss being one of them as well.
Okay.
So that is another one, a component that your primary care doctor can definitely check your thyroid function. And that's easily fixed, and that will like dramatically change your whole life if that were the case.
Okay, and what's that? Thank you. What's another final question? Our final question. Yeah.
If a client has never wore extensions or even considered extensions, what is the best way to introduce them to the possibility of wearing them if they are challenged with thinning hair?
Okay, so did you hear it? It's like if you have thinning hair, never worn extensions, as a dermatologist, what might you suggest is like the first step? And Angela, if you want to step into this conversation as well too, just with your familiarity too.
Yeah, it's interesting. So if you are someone who, a lot of my patients do wear hair extensions, and especially if they are trying to get through this component of just like the temporary hair loss, and that's certainly helpful. I would say just kind of what we discussed earlier is just make sure that you are someone who is ready for this commitment. It's certainly like a large commitment as far as taking care of them. You pay a lot of money to get them put in. And so it's important to maintain them. And then, because if you don't, then that can actually lead to worsening hair loss. Because if you're just not washing them and just like tugging on them all the time, then it's like now you're exacerbating the condition.
Yeah. And now before Angela, before you step in, like that's one thing I will say, just as being in the industry so long, my biggest frustration is I tend to find a lot of women have this concept of like they're paying a lot of money so that they don't have to think about their hair. And I'm like, that's not how it works. You're paying a lot of money and you're still gonna have to take care of and think of your hair. You can't really expect to like put away your hair somewhere in a box and never think about it and it's gonna flourish. You can't pay your way out of taking care of your hair. That's just my personal TED Talk selling extensions for all these years. But Angela, what's your take on it?
Finding a stylist that has a great reputation with knowing the craft of extensions, obviously. Finding someone that you can really feel comfortable having a gentle but really good conversation with about the struggles that you're having is extremely important. I'm very close to every single one of my clients. If we don't mesh, then how in the world am I going to hear the struggles that they're having, if they're having any issues, whatever it is. So, finding someone for sure that knows a lot in this, maybe that this is what they study. I mean, like this is what I study all day, every day. And so I know so many of us across the country who this is what we do. And matching density, making sure that we're not just doing this hair that you're wanting, but you can't have and maintain is very important. So just having real conversations with your stylist about what your struggles are and making sure that they can understand what your struggles are is so important. I mean, not just throwing a bunch of hair in their head and letting them go out the door.
Yeah, and I
Like
do
I
think
keep
that's like
saying, it's
the Covet and
a
main
lot.
difference of like being going to a stylist who is like really committed to their craft, committed to education, and also the importance of certification. I think it's great that you know how to make something look pretty, but understanding the mechanisms behind it and having educators who can give you their experience of those soft skills that are, a lot of this is what we're saying is it's conversations and soft skills. It's not just the technicality, is so important. And it's like the beautiful part of our community and our education program, and then having partners like you, Dr. Safahi. And I think there's been such a, we can't answer all the questions coming in. So we would love to have you back. And we've been working with you ongoing, which has really been lovely for us. And for this reason, which is that it's a big, it's deeper than just hair. Right. And so the more that we can come together and keep learning, I think the more we can be of service to our clientele and patients.
Absolutely.
So
Yeah.
you will, yeah, so we'll be able to connect. For those of you, you can reach out to our education at covetandmaine.com and filter in those questions. And you know, we work with you ongoing. So maybe this can be whether it's another live, or we can do a blog or an email series and some of these like more tactical specific questions. And Angela has, you can always find Angela. She's going to be having our keratin class coming up in Nashville.
Yes, in
And-
Nashville. I'm so excited. That class is sold out.
Okay.
We need to keep those coming because that is such a need for sure. I'm really excited.
Yeah, and you can see she's like represents the best of why, you know, getting educated with Covet and Maine. We have such a great education team, and she really embodies so much of it. So thank you guys for today. This was honestly really for me even to thank you so much. I feel like I learned a lot, and it also opened up a lot of more questions even for us to be thinking about. So thank you so much.
Thank you. Such a pleasure. See you all soon.
Bye.
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 Thanks, guys.